Hi, my name is Unique and I'm a student nurse. Can I follow you around and stuff?
Yeah, that's fine.
May I get an SBAR on this patient that you're doing?
Yes, this is Shanana O'Connor. She's a 34-year-old female, room 231. She is allergic to trimethoprim, sulfamethoxone, and it gives her a rash. She's a full code. Dr. Engelbert is her physician. She's on a renal diet with a 1,500 milliliter fluid restriction, and she was admitted from the ER, a fever of unknown origin, and just generally not feeling very well, so they sent her over here. She reports that her blood glucose has been high the past few months, has less appetite than normal, and her urine is dark. She denies any issues with her lymph nodes. She does have renal failure and has been a type 1 diabetic, was diagnosed when she was 8 years old, so that's been quite a while. Was listed for a kidney transplant 6 months ago, and she has a history of recurrent UTIs, and she had a graft infection 3 months ago, but that was resolved with IV antibiotics. Her current vitals: her heart rate was 108, respiration 20, O2 sat 97%, blood pressure 138/78, and her temp is 100.9, which is one of the reasons why we think an infective process is going on. She weighs 177 pounds. She reported her pain was a 4 a couple hours ago, but she's since had some medication for that. She's allergen oriented, ×4 is cooperative. She has an IV in her right median vein and denies any issues with urination except for it being dark. She has numbness and tingling in her lower legs, probably because of the diabetes, and she is tachycardic but has regular rhythm.
How does it feel?
She is on a number of medications right now, but we're going to be administering imipenem. It's a antibiotic, and we'll be replacing her normal saline that runs continuous. Her last blood glucose was 210.
Okay.
And her white count was a little bit high.
Okay. Thank you. I was just wondering, why specifically is this client receiving this medication?
Well, she's receiving the medication because her white blood cell count was high, and she also has a temperature. They haven't had a culture yet knowing what it is, and this has good action on both gram-positive and mini gram-negative bacteria, so it's a good choice to cover a wide range of organisms.
Okay. So would that be the action of mechanism?
Actually, the mechanism of action, it binds to the bacterial cell wall, and that causes cell death.
Oh, okay.
So yeah.
Thanks. When should you question administering this medication?
Well, I mean, if we didn't think they had an infection, we wouldn't be administering it.
Right.
Also, if they were allergic to the medication, and so she does have an allergy to a different medication, so you want to be extra careful in watching for any reactions. Also, if the dosage didn't seem right, or there was hypersensitivity of any kind.
Okay, that's good. Thank you. Does this medication have a therapeutic serum level?
It does, but it also, via the IV route, doesn't last in the body very long. 6 to 8 hours it usually lasts. That's why it needs to be administered multiple times a day.
Oh, okay. Which physiological parameters should you monitor when administering this medication?
Definitely want to keep an eye on the temperature, also the respirations, the blood pressure, and watch for any injection site reactions. Watch for any possible allergic reaction symptoms.
Okay. So what intervention should be taught to the client to ensure that the medication is administered in hospitals safely?
Well, they should be aware of what medication they're receiving and what times they should expect to receive it. Also, the fact that they have a right to refuse the medication. Really, they have that right for any reason, but it's most important should they think that it's not the right medication. Also, they should be taught signs of a superinfection. So if she was to develop a black furry tongue or was having vaginal itching or discharge, that could be a sign of a superinfection. And the same with Clostridium difficile can be an issue as well because you're killing the bad bacteria, but you're also killing the good bacteria, which can let bad bacteria potentially take over.
So what intervention should be taught for taking this medication at home?
Well, they wouldn't be taking this medication at home because we're doing it via IV, and IV medications are not typically done in the home. But really, any medication, they want to make sure that it's not expired, that's the right medication. And if they have any questions about whether it's the right medication or dosage, they should contact their doctor about that.
Okay. So what are the adverse reactions to this medication?
Well, anaphylaxis is always a concern, so you want to make sure that if they're having any trouble breathing, develop a rash. Already went over the signs of superinfection. Those are another thing with antibiotics, can open you up to superinfections. And if she's having any reactions with her IV site, that's important. If she's having foul smelling stools, that could potentially be a sign of the C. diff, so wants to report that too.
Okay. So when would you know that this medication is being effective?
Well, our hope is that her white blood cell count will return to normal and her temperature will be in a normal range, and that as well as if we do a culture, would hope that it doesn't grow anything.
Oh, that's cool. Okay, so I'm done with my questions.
Okay. Well, I guess let's go meet Miss O'Connor.
Yep.
Line is cleansed before you start priming it. This one is cleansed.
Knock, knock.
Take this cap
Okay.
off. Take this cap off. And then you just
Hello, how are you doing today?
Hey, well, how are you?
I'm doing fine. I'm here to administer your antibiotics, and we're also going to be hooking you up to the normal saline.
this cap off.
So first I'm just going to wash my hands here and double check the computer.
Priming my line. When you're priming your line, Erin, you want to
And
make sure
it's
that you don't have any bubbles
7:44
or
right now,
and
and
that
it
you
looks
reflect
like at
every
8
pore,
o'clock you're supposed to
because
get
if you
your
have
imipenem
bubbles in the
cilistatin.
the machine's gonna start leaking.
So we'll be doing that. Do you have any questions?
I do not, thank you.
Okay. So, first thing we're going to be doing here is the normal saline, because that is our main IV. So I'm just going to scan your band. Can I have your name and age, please?
Sure, Shanann O'Connor, 34-year-old.
Okay, great. So it pops up with her name right there, and that matches what she told me. So that's one of the checks that you want to do. And do you have any allergies, Miss O'Connor?
I do not. Actually, I do.
Yeah, there's one listed in the computer.
I forgot. It's right here. It's a long word. I'm not sure what it is.
Okay. Have you developed any allergies other than that?
This is it.
Okay. So nothing more recent than that.
No, ma'am.
Okay. And I scanned the medication here. Check the expiration date.
Yes.
Also checking for clarity. And as you can see, it is green, which means that we can proceed. It's the right patient and the right medication and the right time.
Okay.
So the first thing I'm going to do before we get this hooked up for her is I'm going to flush her IV site. Have you been having any problems with your IV, Miss O'Connor?
Nope, no problems at all.
Okay. So I'm going to make sure that I scrub the site here. Because you don't want to get the IV started only to find out that the site isn't open. Are you having any pain?
No pain.
Okay, and it's flushing appropriately. So we're just going to close that off for right now.
And it's asking you if it's a new patient, and you say yes.
And now I'm going to hang
Say yes.
this. And it is a continuous infusion at 30 milliliters per hour.
Okay.
And because we're going to be doing a piggyback, I'm hanging this lower to encourage the other one to flow. I'll be priming the tubing. That's just to get all of the air bubbles out. You don't want those to be going into the patient.
You pick your IV fluids, and then you pick your normal saline. That's sodium chloride. You say yes,
that's
and today,
flowing
just 30
here.
milliliters, but I'm just gonna check it a bit more to make sure. So it's 30 milliliters, yes. 30 milliliters. And the bag is 500 milliliters, so you just
Okay.
wanna put 480.
So, yeah, I want to make sure that we get all of the air bubbles out of there.
Change the bag. Your wine.
So the other thing you can do is let the machine prime your tubing for you. So what we'll be doing is inserting that piece there, and this down here. Might have to stretch it just a little bit. That should snap in there. Okay. I'm going to turn the machine on.
Maybe 5 drops. Okay.
Okay, it is a new
5
patient.
of them, so I'm gonna
Med surge area.
Okay. Good that I haven't started. I'm just gonna
Okay, so now what we're going to do is we're going to do channel select,
here in the line.
and it's the guardrail IV fluids, and it's the normal saline right there, and it asks, is this correct? Yes, it's correct. So you press yes, and we want it to do 30 milliliters per hour, so I press there.
So that might be
Okay, and then that stands for volume to be infused, and it's 1,000,
Yeah.
but we're going to do 950 to make sure that I have time to get back to the room before it is done. Okay, so now I'm going to
And I'm just gonna
Enter.
document on the computer
Yeah.
that I administer the medication to the right median vein.
Yeah.
Because you need to put the site, you need to put the time, and you need to put how
Okay, press, there we go. I was having trouble finding the start there. And I'll just watch for a second here. Okay, I'm going to get this hooked up to our patient. This right here was under a sterile cap.
Yeah.
That's why, because you need to make sure everything's sterile.
I'm just gonna pause it.
Okay, so we have that running.
Yeah, you know, it's like
Okay, so I'm going to put in
get like
here
a very small
that
bit bubble in like a
I
cork.
administered this
It's very hard to get it out.
at 750. this is something that happens sometimes when you close them off after flushing. You forget to open it back up again.
Yep.
So that's always the first thing to check, and it said patient size, so that's how you know
Okay.
that's what's going on there.
And I'm gonna administer imipenem anti-infective medication, 500 milligrams over 100 milliliters IV piggyback every 8 hours, and the time is 8 in the morning. And this is the right medication. I'm also gonna check it. I'm gonna check the back for color clarity and expiration date. And color is good. I don't see any.
So now we're ready to start with the piggyback.
Expiration date
And
is fine. Is
it
September.
is
So
just
we are
before
good.
8 o'clock, and it's to be
See what's
administered at
going on
8.
with
So we're going to do the same thing. Can you please tell me your name and age, please?
Sure, Shannon O'Connor, 34 years old.
Okay. And sometimes you have skin more than once. Okay, there we go. It pops up. It matches the information she gave me. This right here is the imipenem psilocybin, and I'm checking for clarity. Check the expiration date. It's
Yeah.
not expired. And then also I spiked it in the med room, but you want to make sure that you keep these parts sterile.
Okay.
Everything for the patient needs to be sterile with the IV. We don't need them to get another infection. So then I click here, and I'll be scanning the medication to double check, make sure that's the appropriate one. And as you can see, it turned green. That means that it's the right one. So there's 100 milliliters, and in that is 500 milligrams of the medication, and it's to be administered at 8 o'clock. It's just before 8 o'clock now.
Okay.
So I'm going to do the same thing as far as priming the tubing, but because there's not much of this, you want to make sure that you don't waste any, so you just get it perfectly primed. Okay, so we did that. And this is going to be hanging higher than the other medication because of the fact that we want gravity to help us. You want the port before the machine, because if you don't do that, it will just drain into the patient, and that could be really dangerous. I've actually seen people make that mistake, so that's something to make sure that you're remembering. I removed the sterile cap from this one, and then it goes here, screws right on, and I'm going to close this for a moment and pause and set up the new infusion. So once again, we're going to do channel select, and I want to do a secondary, and it's going to be right here. Okay, so it's the imipenem psilocybin. You see that there? So you choose that, and it's this right here, 500 milligrams and 100 milliliters. We already talked about that. So I press that, and it says, this was selected. Is this correct? Yes, it's correct. It's exactly what we wanted.
Yes.
Okay, so the diluent is 100, and in that, there's the 500 milligrams of the drug.
Okay.
So it says, press next to confirm. So we're going to press next, because that's correct. Okay, and it already has volume to be infused, and we are going to go ahead and just go ahead and do this over. Okay. Perfect.
I'm just gonna cleanse it with this sterile alcohol pad, and I'm just gonna try to define my line.
Okay, so we're going to go ahead and do the rate. We're going to do 100 milliliters per hour. Do this over an hour. Okay. And there we go. So I'm going to open this clamp up here, and then I will press start. Okay, and I want to watch for the drips here. Make sure that they come down.
Come in here again.
Okay, so watch for the drips. Make sure that's infusing.
I can see it.
Yeah, because the last thing you want to do is leave the room only to find out that hasn't been infusing, come back to take it down and have it not have gone. So now we're going to do the same thing here. We need to make sure that we put the time that we administered it.
And I'm gonna restart it. And now I'm just gonna scan my medication.
Okay. And same thing. And now I'm going to give
And it's been
the
verified.
patient some teaching information. I have some information on your medication for you.
Okay.
And if you have any questions about it, make sure to let me know. Here's your call light. You can press that if you need me. I am also going to make sure that I label the line. It has my initials and the date that I put the IV lines up. Also what's in there so they can make sure that it is compatible with whatever they want to hang.
Okay.
Okay, I'm going to finish charting this right here.
Let me try one more time. I'm just gonna hang like that. And you do the same thing. You just need to take this cap off and then spike it. And
Okay, is there anything else that I can do for you right now?
half of
I think we're good, thank you.
Great.
You want to make sure that with orthodontics, when you find your line,
Hey, thank you for letting me watch.
Yes, no problem.
So yes, I actually have a couple more questions to ask
Okay.
you. I was just wondering, were there any pertinent pieces of information you reviewed before administering this medication?
Yes, I did. I reviewed the patient's most recent vital signs. Her white blood cell count is a little bit elevated. I also reviewed her allergies and I checked them again with the patient, make sure that there was nothing that wasn't in the system because antibiotics are a big one that allergies can be a problem. I confirmed that it was the right patient. I confirmed the time.
check it one more
It was appropriate to give at this time.
Okay, that sounds good. Did this information affect your decision when administering this medication?
It did because I wouldn't have administered the medication if the patient had been allergic or if it wasn't the appropriate time to administer the medication, or let's say that their IV site was not patent, I would have had to start a new IV site. But at this time, it was the appropriate thing to do to administer the medication, help her with the infection.
Okay. It kind of redundant, but I want to ask you, did this affect how you administered the medication?
Well, this is to be administered IV piggyback, and given that her IV is patent and she's indicated to have the medication at this time, it was the appropriate method to give the medication.
Okay, thank you so much for letting me go
Yeah.
out with you.
I hope that you learned some things.
Yes, I really do. Thank you. Bye.
Thanks.